All right, so now we're going to come to knees cave in. So when they're out in this squat, you want their knees to drop straight down like a plumb line, where if we had a little piece of string coming down from the knees, it would touch like the second and third toes. A lot of people are going to have this thing where their knees cave in, right? Their knees are going to come towards the midline. So we ask ourselves, okay, what is tight? When we are talking about knees caving in, I want you to just do this movement, right? So just look down at your knees, and then as they come into the center, the knees are adducting. Isn't this great that we already studied adduction, right? So knee adduction is when the knees come to the midline. So come up here like around your groin, right? These are going to be your adductors. You can feel it. It's like that rope of muscle that is like in your groin area. This is it. This is the adductors. Picture this. If this muscle bunches up, just like we have from our muscle imbalance picture, if this bunches up, how does the body compensate? How does the body respond? So if you tighten, if you shorten that muscle, it's going to pull your knees in. All right. So tight adductors cause knee adduction. They are there to adduct the knee. That's what they're supposed to do. But if they get too short, then they are going to cause that like as a chronic state. Okay. So that's that. Now, on the outside of your body, on the outside of your thigh, one of the muscles is the TFL. So you want to know this as the TFL, and you want to know it as the full name, tensor fascia latae. Latae is the Latin word for lateral. So whether they say latae or they say TFL, I want you to see that L and think lateral, lateral. So anything again with lateral movement, knees cave in is a lateral compensation, right? We're not moving front and back this time. We're cheating by getting our knees in. So the other muscle that is tight there is your TFL. The reason why it matters, the lateral thing here, even though it doesn't say the word lateral, we know that that's what it means. It's in Latin. It means lateral. Lateral muscles go tight. Anytime you see a muscle name, if it has the word lateral in it, it's going to be an overactive muscle. It's that simple. That's the lead muscle of the group. So they are the ones that have a tendency to go tight. If you see any, there's not an example here, but the opposite is also true. Any muscle that has the word medial in it will go weak, will be an underactive muscle. So for the test, this is a great tip because you can always kind of double check that way. If you see lateral muscles, they can only be the answer if they're asking for something overactive. If you see medial muscles, they can only be the answer if they're asking for something underactive. Okay? So that's that. Now, let's think about this. We have the adductors on the front side of the body, right? This is going to be like your groin, the front of your thighs. So what do we expect to be weak? Well, let's come around to the back side. That's all we have to do. Your hip abductors are your glutes. So I don't know why, but they don't use the word glute. They don't use the word abductors. Just they will say adductors for the front. They don't ever say abductors, but your glutes do abduct the hip. So anyway, we just want to think about it like this. Front side adductors are tight. Back side is where your glutes are. Glutes are weak. Now, if you see here, also weak when the knees cave in, anterior and posterior tibialis. Great, that's fine, but we don't need to learn anything new because we already know that those are muscles that go weak because they were weak when we did the feet turn out. Okay. So back to the knees cave in though. I said we would skip the glutes for the last one because this is where we're going to talk about it here. This one makes sense. Adductors front tight, glutes back weak. They get stretched out. Anytime for the test you see any glute muscle, whether they say gluteals, meaning all the glutes together as a group, or they say gluteus medius, let's start minimus, gluteus minimus, gluteus medius, gluteus maximus, whichever one they say, it doesn't matter. All glutes are weak all the time. There's never, ever, ever, ever going to be an answer on the test where you say that the glutes are an overactive muscle. Never, ever. They are always underactive. And this helps so much for the test. When we get to the practice questions, you'll see why. But just remember, glutes are weak. Now, if you're doing it the way where you're logically trying to think through it, if the knees cave in, what tight muscle? What muscle does knee adduction, right? Where if it gets too tight, it's going to pull those knees in, right? That's going to be your adductors. Then we do front side, back side. They're tight on the front, they're too short. That means they got stretched out on the back, too weak. What's here on the back side? It's the glutes. Okay? So now we're going to do arms fall forward. So